Hello everyone. Today, I want to clear up a massive misconception that's leading people down the wrong path with their digestive health. Most people use gas and bloating interchangeably. They're not the same thing. Understanding the difference is crucial for figuring out what's actually happening in your body and how to fix it. Let me break this down clearly. Gas is a substance. It's literally air, composed of nitrogen, oxygen, carbon dioxide, methane, and hydrogen. According to research, the average person passes gas 14 to 23 times daily. That's completely normal. Gas is a natural byproduct of digestion. When gut bacteria break down food, especially carbohydrates and fiber, they produce gas. That's gas. Bloating is a sensation. It's the feeling of fullness, tightness, or distension in your abdomen. Here's the key: you can have bloating without excessive gas, and excessive gas without feeling bloated. A study in gastroenterology journals examined patients with bloating and found 40% had normal intestinal gas levels. What were they experiencing? Visceral hypersensitivity, where gut nerves are overly sensitive to normal amounts of gas or stretching. Think of gas as water in a balloon, and bloating as how tight that balloon feels. A small amount of water in a sensitive, tight balloon feels like it's bursting. That's bloating with minimal gas. Or lots of water in a flexible balloon that doesn't feel uncomfortable. That's gas without bloating. Your gut works the same way. Research has identified bloating mechanisms unrelated to excess gas. One study found that people with irritable bowel syndrome often have impaired gas transit. Normal gas amounts, but the gas doesn't move efficiently through the digestive tract. It gets trapped, causing localized distension and bloating. Another investigation showed some people have abdominal phrenic dyssynergia, where the diaphragm and abdominal muscles don't coordinate properly, leading to bloating even with normal gas levels. Here's an example. Two people eat the same meal, beans and vegetables. Person A produces gas, passes it normally, feels fine, efficient gas transit. Person B produces the same amount but feels bloated and uncomfortable. Slower gut motility, more sensitive nerves, same gas, completely different experiences. When you have excessive gas, symptoms are frequent flatulence and belching. Causes include gas-producing foods, swallowing air, or bacterial overgrowth. Research shows direct correlations between high FODMAP foods and increased gas production. But producing gas isn't problematic. It's your gut bacteria doing their job. Bloating presents differently. Studies show people describe feeling swollen, tight, with visible distension. Causes are complex. Gut dysmotility, visceral hypersensitivity, altered gut-brain communication, food intolerances, triggering inflammation, hormonal fluctuations, and stress-induced digestive changes. Think of your digestive tract like a highway. Gas is the cars. In a healthy system, cars flow smoothly. That's normal gas transit. Bloating is a traffic jam. The problem isn't too many cars, it's that cars aren't moving efficiently. The bloating feeling is that traffic jam, that sense of congestion, regardless of actual car volume. This distinction matters for treatment. A study found people treating bloating with anti-gas medications saw minimal improvement because they addressed the wrong problem. The issue wasn't excess gas, but how their gut handled normal amounts. When they tried approaches targeting gut motility, dietary inflammation triggers, or stress management, bloating improved significantly. One investigation examined women's cyclical bloating before their period. Gas levels didn't increase during these times. What changed was gut sensitivity and fluid retention from hormonal fluctuations. That's bloating without excessive gas, allowing hormone-related treatments instead of gas reduction strategies. Here's the takeaway. If you're passing gas frequently but don't feel bloated, you likely have active gut bacteria breaking down fiber. That's healthy. The solution might be moderating high FODMAP foods if frequency bothers you, but it's not a medical concern. Adequate fiber should produce some gas. It's a sign of good digestive function. But if you feel bloated, if your abdomen feels distended even without excessive gas, that signals something different. Look at gut motility, food sensitivities, stress levels, eating speed, and potential conditions like SIBO or IBS. One clinical trial found people with bloating who practiced mindful eating, reduced stress, and identified trigger foods saw 70% improvement, even though gas production didn't change. Gas and bloating are related but separate issues requiring different approaches. Treating them as identical is why many struggle to find relief. Understanding what you're actually experiencing is the first step to feeling better. Stop assuming they're the same. Pay attention to what your body is really telling you. Thanks for watching Nutriflow, and let's get clear on what's happening in our guts so we can address it properly.